Hi, my name is Kiara Sellers, and I will be doing my oral presentation for my English 112 class on reasons why I feel as though healthcare workers should receive the flu vaccination. The flu is a parasite. It has grown yearly. The CDC reports that the year 2017 through 2018 was one of the biggest years of flu-related deaths, and also 900,000 hospitalizations across the nation. Compared to previous years, those have the highest ratings. Although a great number of citizens they do receive the flu vaccine, we still have a big number of people, and also included healthcare workers, who refuse to get the vaccine, which I feel as though it should be taken into consideration for mandatory placement because there are major risks. Emily DeYoung, she states in her article that healthcare workers who refuse the flu vaccination and have a legitimate reason are forced to wear masks their entire shifts. Just think, 12 hours to 16 hours wearing a hot mask can be unbearable. As a healthcare worker, you come in contact with so many different illnesses because you deal with sick patients. And if you receive the flu vaccine, you're protecting yourself, you're protecting your patient, you're protecting your coworkers, and you're also taking in consideration of protecting your family that you have to come home to. The flu is very uncomfortable. It can be very life-threatening. It's important to receive the flu vaccination yearly because each year there's new products enforced into this vaccination because each year the flu virus grows and it adapts to that previous vaccine. So that's why each year a new vaccination is produced to fight that virus. The CDC reports that an annual vaccination is the best way to protect yourself from the flu. The vaccination has benefits as far as respiratory illnesses, pneumonia illnesses that can be flu related. It can prevent that. The CDC, it does require, not so much require, it recommends that all healthcare workers do receive the vaccine. A great number of healthcare workers, they refuse the vaccination due to religion beliefs, allergies. They might be allergic to some of the products that's in the vaccination. But we have some people that just feel as though they're healthy and they will not get the flu. Healthy people do get the flu. Each year, hospitals, they do send out letters, they send out emails, they send voicemails out to their employees, letting them know when the campaigns will begin and where you can receive your vaccination, which is a good idea. But having just that into place, that is a good resource into being a reminder. But if you enforce this policy, you're protecting yourself, you're protecting everyone. So I feel as though even if you do have a religion belief, you still, maybe the CDC will, and the pharmaceuticals places eventually will have something to prevent them to prevent them to go against their religion beliefs. But as you know, the winter months come, and that's when the campaigns, they do roll out. So I feel as though that, yes, the flu vaccine is the number one prevention. And working in the hospital, you're there to protect yourself. I mean, you're there for the patients, but you have to protect yourself first.